Hey guys, welcome to another live session with Transform. So today we are going to have Dr. Charan with us. He's a renowned neuropsychiatrist from Hyderabad. So we'll be taking a lot of questions on mental health, basically talking about anxiety, depression, or any sort of suicidal tendencies. So if you have any questions relating to them, you can just click on the questions icon at the bottom, and we'll get going. So we'll be waiting for Dr. Charan to join us. So we're doing this session basically to raise awareness about mental health and suicidal prevention. So September 10th is basically celebrated, not actually celebrated, but basically there's an event called as World Suicide Prevention Day to basically give user people awareness about suicide prevention. So keeping that in mind, we are basically trying to clear as many doubts as possible for people. So as soon as Dr. Charan comes live, we will start the session. So in the meantime, if you guys have any questions, please send in your questions. We'll be putting them across. We are not going to reveal any names. Please stop. Don't use the comment section because it's really difficult for us to find these questions. Hey Doc, how are you?
Hi. Hi, Sandeep.
Hi. So welcome to our live session on Transform.
Thank
This
you.
is the first session actually we are having with the doctor, so it's really exciting for us because we always have fitness trainers or dietitians or somebody. So it's really nice that we are having this session with you.
Exercise and health goes hand in hand.
Exactly, right. So just before we get started, Dr. Charan, just to understand, from your end, right? Can I just understand why did you actually get into this field, mental health, being, a neuropsychiatrist? Was there any reason for you to actually get into this field?
Um, I was very curious about brain while I was in
Mm-hmm.
MBBS. This is way
Okay.
back in 2005.
Okay.
Like most of the medical students, they usually tend to fall in love with one of the organs, if not the entire body, through the course of MBBS.
Okay.
So for me, that was brain. And
Okay.
I could have taken either neurology or neuropsychiatry. There were two options in neurosurgery. So I chose neuropsychiatry because the scope is very good, and I see
Okay.
the number of patients suffering with mental health conditions are getting higher day by day. It's not getting less, thanks to the
Yeah, exactly.
stress that people put themselves into or is put on them. And
Mm-hmm.
me personally, through clinical depression in my teenage, so I think that gave me a
Mm-hmm.
push to pursue this so I can
Okay,
help.
pursue this also. Yeah.
Yeah, yeah.
So just to understand, when because say Transform is about fitness and diet, right? And we also are coming up with mental health as well. So a lot of people talk about this ratio, saying that getting fit is 30% fitness and 70% diet. But everybody forgets the mental aspect of it, right? So just to put it straight, how much do you feel? Because we talk about a lot of people when you talk about athletes, say a Virat Kohli or a Sachin, or say, a lot of our people who are winning at the Olympics, right? The mental frame is so important. People talk about being in the right mental frame of it. But again, when we talk about fitness, everybody says 30% fitness, 70% diet. So how important is mental health to this entire aspect of actually a fit body, basically?
So you see, if when it's about losing weight, right, the goal is
Hmm.
very, very different. It's when it's about staying healthy, uh, the term of exercise is very, very different. You know,
Hmm.
so for me, what I think is, exercise and eating healthy shouldn't be for a goal of losing weight or to have a six pack abs or a body like that. I think it is
Hmm.
mostly about having a disciplined life. So you're physically and mentally more active. So it's a cause and effect. If you work out, you'll be mentally more fit. If you're mentally
Hmm.
active, you'll be wanting to work out more. So they both go hand in hand. I
Mm-hmm.
always tell my patients, please go work out, not because you're fat or you're thin or you're moderately built. It is about
Mm-hmm.
when you exercise, there is release of endorphins from your brain, which are
Okay.
natural chemicals, natural chemicals produced by
Mm-hmm.
the brain that keeps you alert, focused, happy, active, attentive throughout the day. That's what you need for your brain to
Mm-hmm.
function at its best capacity. For that reason, you need to exercise. Well, looking good
Okay.
is the second byproduct which comes along with it. So,
Okay. And when you talk about, so before we get into more serious things about anxiety, depression, and all these things, we get a lot of these questions from people who say, I'm not motivated enough to actually do something, right? So, from a mental aspect of it, is there something that people can actually visualize or do, or how can they actually prepare themselves? Because a lot of people actually motivation is the biggest factor when it comes to doing something, physically, right? Because you're going to put your body to something. So is there something that you would suggest people ki, okay, some mental preparation that people can do to get into that frame of mind?
um, so see, motivation is a very broad, like a spectrum of things, right? As a doctor,
Mm-hmm.
when somebody comes to me and saying that I'm not finding motivation, I tend to look at the medical tests of it. I don't tend to look at
Okay.
psychologically where you are because I'm not a psychologist. So I tend to look at how are the vitamin levels. People who are staying indoors mostly, not getting enough exposure to sunlight, they can have
Mm-hmm.
vitamin D deficiency. Vitamin D is that one vitamin needed for a part of your brain which is associated with motivation.
Mm-hmm.
So there are different parts of the brain
Okay.
that deal with different functions of us. Right now, when I'm talking to you, I'm thinking and talking to you.
Mm-hmm.
Right. So a part of my brain is
Yes,
active.
okay.
Likewise,
Mm-hmm.
there are different parts that will help me remember what I learned in my MBBS maybe, so that I can talk.
Mm-hmm.
So all these areas of the brain need to be stimulated. For that reason, some of the vitamins are important. What kind of diet we take is important. What kind of environment we are in is important because when a person is under a lot of stress, like most of us are under a lot of stress, or stress is like constant in our life.
Exactly.
It releases something called cortisol in our body, which is a stress hormone. It's actually good. That hormone is
Mm-hmm.
going to do a lot of good for us. But when it's secreted in
Mm-hmm.
too much amount, that can be the effects can be deleterious. There
Okay,
will not
got it.
be much hope left for you. So I think motivation has as a word, not as an English word, but as a medical word. It has to do with your vitamins, the food you intake, the amount of stress that you are in. All this. For example,
Mm-hmm.
if I am in a highly stressful work environment, I will not find much
Mm-hmm.
motivation to do better. If I'm in a
Mm-hmm.
moderately stressful environment, I will work very well because that little amount of cortisol is required for me to work well.
Mm-hmm.
So it's about that balance.
Understood, got it. And so coming to a couple of other common things where people, how does somebody, first of all, understand if we're getting into the seriousness of mental health, right? A lot of people have this issue, and we're getting a lot of questions where people ask, first of all, how do we even diagnose ourselves? Say, for example, how do I know I have an issue? What is the difference between, say, stress and anxiety? Simple things, right? Or a lot of people do not understand whether they're even in depression or not. So, is there a way for people to, first of all, understand that, okay, there is something which is wrong? Is there a way to diagnose themselves?
So no one should diagnose themselves. That's the first rule.
Okay.
No self-diagnosis, no Google diagnosis. You have to because
Okay.
we don't study 11 years for nothing. There are
Hmm.
Google makes it very easy. It says that if you're having A, B, C, D, E, you're probably depressed. But there's a word called
Okay.
probably depressed. You can never be sure.
Okay. Okay.
So you'll always have to see a doctor to find that. But other than that, for you to know the reason why I should even see a doctor, you are the best judge.
Hmm.
Not your parent, not your spouse. No one can tell you that you need to go see a doctor. Only you should be able to know
Okay.
that you need to see a doctor. See, most of the mental health conditions, when you say depression, anxiety, they're English words. We often use them
Hmm.
very loosely, saying that I'm feeling very depressed since last 2 days, or I'm feeling
Hmm.
very anxious. I have an interview. These are very
Hmm.
such commonly used vocabulary in day-to-day life.
Hmm.
How do you differentiate between, let's just say, sadness and depression? So sadness is a
Hmm.
normal emotion that we all experience in some part of our life or some part of our day. It's very normal. You
Okay.
don't have to go and run and see a doctor. But when you see
Hmm.
the intensity of sadness is getting more, it's taking over your entire life, entire day, entire situation. And most of the times you're feeling very, very low, and nothing that you're doing is cheering you up. For example, if
Mm-hmm.
you're low, let's just say you're low and your girlfriend would cheer you.
Mm-hmm.
That's normal.
Okay.
But now, when you're clinically depressed, nobody's able to cheer you up, not yourself, not anyone else.
Okay.
That should tell you
Hmm.
that, this is not normal. This is not how I usually function. So listen to your body, listen to your mind. It's not that difficult. It's not like COVID. It's not cold and cough, and it's not a viral infection. If you're
Hmm.
understanding that, okay, you know what, my grades in the school are dropping, my work performance is
Mm-hmm.
going less, my relationships with others around me is getting affected, right? I'm
Mm-hmm.
acting in a very different way than myself. That's when you need to, understand that probably it's getting serious. So might as well go and see a doctor.
Hmm. So I think so the best thing would be if you are not able to basically cheer yourself up or even somebody, something happy around you, not actually able to cheer you up, that would be a right sign to basically go and start seeing people, right?
Yeah. So
That,
that. So
yeah.
I tell all the patients, like, come and see a doctor. What's the worst that will happen? I'll say, you
Hmm.
don't have depression. Go back home. That's not such a bad thing
Hmm.
after all. You would have lost like maybe 500 rupees and 10 minutes of your life. That's okay. So
Hmm.
don't have, I know, like, health education has become so vast in the last 2 years because of pandemic, but health education
Mm-hmm.
is a tool for you to understand what's happening with your body. It's never a tool for you to diagnose yourself or treat yourself. No, that's not the goal
Hmm.
of health education.
Hmm. And what if suppose somebody feels this way? What do you recommend for them to do for the first thing that they should do? What are the options that they have basically to explore? Is it like the only option is going straight to a doctor, take an appointment, or are there other options for people to do, get them checked up?
So let's just compare it with a headache, right? Which is a very common.
Mm-hmm.
I'm sure all of us experience headache on a daily basis.
Okay.
If I have a headache, what do I do? The first thing I do is I take a paracetamol, or
Mm-hmm.
I do a head massage, or I tend to, give rest to my eyes from screen. I may not look at TV for some time, uh,
Exactly. Hmm.
etc. Right? You don't immediately run and see a doctor. Some of us
Hmm.
do, but most of us we don't. But after doing all these also, your headache is not going down. It's only getting more severe. It's getting
Mm-hmm.
associated with other symptoms. Uh,
Mm-hmm.
that's when you go and see a doctor. So same thing with mental health. That mental health is not different from physical health. They're not two different, countries or continents.
Different things.
It's
Okay.
the same thing. Your body has brain, your body has liver, it has heart. So all of them work together. Unless they work together, you just can't function as a human being. So same thing
Hmm.
applied to, let's just say, anxiety. I'm feeling anxious now. I'm feeling anxious
Hmm.
every time I have let's just say I have a live talk. I'm feeling anxious. I don't immediately go and see a doctor. I tend to take some
Okay.
deep breaths. I tend to maybe meditate for some time. I tend to use
Mm-hmm.
some techniques called visualization or muscle relaxation, etc. In spite of that, I'm
Mm-hmm.
not able to calm myself down, and that's when I go and see a doctor. So it's exactly that. So
Okay.
when you stop differentiating between mental health and physical health, I think you have a lot of clarity by yourself, because we are so used to physical health conditions. We know when to go
Mm-hmm.
see a doctor, when to go see a pharmacist,
Yeah, I think
when to
one of
go.
the biggest problems is this Google thing, right? People just Googling everything and then thinking that they know everything, right?
Yeah.
Even for medicines also. So I think that, and how do you deal with this aspect of, a lot of people are still very shy, right? They to come up and actually, just like how sex education is still a closed closet thing. The same thing with mental health now. So there are few people who are coming on, like Mahama Saki, coming and saying, "No, I cannot do this." So people now understand that yes, there is a serious thing, and it's pretty normal for people to have these things, right? So, what do you have to say to these people, who basically have this sort of thing? Is there something that they can do? Because for them, probably going to a doctor is a bigger step. So, is there something that they can do which is easier for them?
I think, see, to have good mental health, you don't need to do some great things in your life. You just have to do very
Hmm.
simple, basic things. For example, very simple things. As a generation, I think we all fail in doing these simple things. We all achieve for some greater heights and big ambitions, but in the whole process, understand that we're not eating right, we're not drinking enough water, we're not sleeping well. we are not knowing how to relax ourselves. Most of the times we are sitting with our screens. There is no physical activity. You're not going out and playing or a sport like we used to in the past. So
Yeah,
when you're
exactly.
doing, yeah, when you're doing all of this right, the chances are that you won't have most of the mental health conditions. Well, there are genetic conditions that you really can't change much, but otherwise,
Mm-hmm.
environmental conditions that occur, you know that
Mm-hmm.
that will get better by itself. So I think the whole point is to have a good lifestyle. See, when you talk about
Mm-hmm.
anxiety and depression, because that's what we are mostly going to talk about, they are
Mm-hmm.
lifestyle conditions. They are not infections, right? uh,
Hmm. Exactly.
just like diabetes and hypertension, they are also lifestyle conditions,
Mm-hmm.
right?
Mm-hmm.
There are, let's just say, some 10 lifestyle conditions: stroke, heart attack or cardiac arrest, diabetes, hypertension, depression, anxiety, cholesterol levels altering in your body. All these are
Mm-hmm.
lifestyle conditions. So the only three things is exercise, eat well, drink lots of water, and sleep adequately. If you do these four, the chances are that you will not see a doctor ever in your life, which is a good thing.
Okay, got it. Understood. And a couple of people are asking when you are talking about anxiety, right? Is there a possibility that certain foods actually trigger anxiety?
Oh yeah, for sure. Any
Okay.
food that moves very slowly in your intestine, in your gut, can,
Mm-hmm.
because there is a gut brain axis. Anything that you, how do you feel hungry? You don't feel hungry from your stomach. You feel hungry from your brain. There is a
Mm-hmm.
appetite center in an area called hypothalamus in your brain. Near pituitary gland.
Okay.
I don't want to get technical, but just know that
Mm-hmm.
my hunger, my thirst, my sex drive, my attention, everything, nothing comes from the peripheral organs. It all comes from the central organ called brain. The brain is the
Okay.
master of every organ. So,
Mm-hmm.
any food that you eat, when it's moving slowly, when it's not able to be digested, absorbed, or broken down slowly, it sends signals to
Mm-hmm.
the brain. So, brain goes into a panic mode that can cause anxiety.
Oh, okay. Okay.
Yeah, it's always good to eat multiple small meals. I think none of us do it because of our lifestyle. Right? It's
Yeah.
very difficult for me to keep eating every 2 hours or 3 hours like that.
Mm.
So I think I mean,
But again, how does somebody differentiate between, say, a stress and anxiety? Because anxiety needs a bit of attention, right? And I think right now, with everybody's workload and with the world running here and there, everybody is under a bit of stress, right? And also, I have seen that you used to have this old saying, right? Until you are under stress, your best is not going to come out. I think because I've seen that there are two generations of people now, where the old generation is like, "Are if you're not going to put stress on him, how is he going to get better and how is he going to manage?" And then there is another set of people who say, like for example, the grading system now, it has completely changed, right? No marks, ABC, so that there's no pressure on the child. So how does somebody differentiate between stress and anxiety? Because I think those are very intermingled things, and people are. I think we're getting a lot of questions on that. How do we understand that? Okay, I just need help now with anxiety.
so I mean, I'll answer the first half of your question. There is no
Hmm.
much unless you put pressure, people won't perform. Um,
Hmm.
I don't agree with it personally or professionally. See, olden
Hmm.
days, how did people succeed? How did people have good health in spite of not having great health system? Back in the day, we
Hmm.
didn't have these advanced technologies or tests to perform, or great, advanced surgeries. We don't have good medicines. We didn't have. Not even too many doctors. Very few doctors in the olden generation, but none of them had many health problems. Most of them were fit without even hitting a gym. Just by doing
Hmm.
their household chores, and they didn't have any pressure because there was no competition, right? Even now,
Hmm.
my grandmother, she's a gynecologist. She was one of the top
Okay.
gynecologists of the state. When she tells me that you had to work hard, push yourself, I immediately tell that you guys had it easy in a way. Like, they had their own struggles, right? I mean,
Hmm.
right, it's not, I understand that side of it. Definitely they had their own struggles
Hmm.
back in the day, but there was no competition in sense of nobody is competing for the same place. everybody
Okay,
has
got it.
Everybody can find their own feet. But for us,
Hmm.
because of the population increase and expectations have increased, for us, I think we changed, we are working very differently. Our priorities, we have so many goals. We have so many motivational speakers giving motivation. I think
Hmm.
back in the day, they only thought of just, having basic necessities like food, shelter, clothes, and staying happy and having a good
Hmm.
family system. I think if we try to go back to those little old ways, I think we'll be out of stress for sure. Right? Stress will be reduced.
Hmm.
But it's not just only you and me going back to it. I think as a
Hmm.
society, collectively, when we go back, is when I think we'll be in a better place. That's the first thing. Second part of the question is what is the difference between stress and anxiety?
Anxiety.
Anxiety disorder. I'll talk as a doctor. I'll talk about anxiety disorder. Anxiety disorder is a
Hmm.
medical condition.
Hmm.
Anxiety is a normal emotion, just like sadness, happiness, or anxious, etc. Stress is not a disease, it is a risk factor that causes lot of diseases. So
Okay.
stress not just causes cancer, anxiety, it can cause cancer, hair loss, uh, drug abuse, many, many, many things. So
Hmm.
stress is a risk factor. Um, it can be a physical stress or psychological stress. It causes a spectrum of diseases in the medicine.
Hmm.
Anxiety is a normal emotion. That I feel anxious if I have an exam tomorrow. It's normal. I feel anxious if I have an interview tomorrow. I feel anxious even if I'm getting promoted and getting a bigger salary because the responsibilities are going to be more.
Hmm.
That's a normal emotion. Anxiety disorder is an abnormal condition that requires you to see a doctor because even
Hmm.
without any stress, just the thoughts that, oh, what if this can happen or that can cause too much of anxiety that can put pressure on your heart.
Hmm.
That's when you need to see a doctor. So all three are very, very different.
Okay, so I think all of those people who are asking stress, I think stress is pretty normal. So I think you should not get panicked because of actually just having stress. I think so. One of the
So
other things is,
about
yeah,
about
sorry.
stress, I think all of us are going to have stress in our life at some point or other. It can be
Exactly.
it can be financial stress or academic pressure or relationship issues or a job pressure. These are the usual stresses, right, in our life. Let's just say in our
Hmm.
age group. I think how we react to the stressor is what will decide if you're going to have a health condition or not,
Okay.
right? Even
And
if you
does
see,
anxiety
for example,
actually lead you to sorry. Yeah, yeah, sorry.
no, like in a family, for example, you lost somebody, right?
Mm-hmm.
And your three siblings. Example, your three
Mm-hmm.
siblings. Of course, all three of you are genetically related. So good chance
Mm-hmm.
that if your parent had depression, you might also get it. One of you might get it, or two of you might get it, or all three might get it. But then
Okay.
just when you're grieving about somebody that you lost in the family, all three won't have clinical depression. Maybe one might have or none might have. What decides
Mm-hmm.
that is how your environment is, how you process things. So how you
Okay.
react to stressor will decide, has some influence on if you'll have a mental health problem or not.
Okay, so is this actually is mental health also a bit of genetic part attached to it? Because there are like some diseases which are obviously genetic, right? But is mental health also genetic? Because you're saying that if somebody in your parent has and then you have three, four siblings, there is a possibility. Is it genetic
Uh,
or?
Mental health conditions, some of them are
Mhm.
definitely genetic. I
Okay.
personally think most of the health conditions are genetic. The
Hmm.
things that we think is not genetic, we just don't know yet because the genetic medicine is not as advanced as other parts of the body.
Okay. Got
So we
it.
don't
Okay.
know. For example, I'm sure like, COVID is not genetic, right?
Hmm.
Definitely it's not genetic. If somebody coughs at you, you'll get it. It's just your fate.
Hmm.
But I feel like how your lungs react to eliminating an infection or fighting an infection is genetic.
Okay.
So when you
Got
look
it.
at genes, I think I feel most of the conditions have genes as a basic, foundation on which we build
Foundation. Okay.
other things. Yeah.
Got it. And just on the last question on anxiety, can anxiety actually lead to a panic attack? And if so, like, how do you basically understand? Because a lot of people have not experienced these things, right? So how do I know that I have a panic attack? Is it very clearly differentiated or, you know?
So panic attack is the most severe form of anxiety that you will have, which is short lasting, for sure. Thank
Mm-hmm.
God it's short lasting. It lasts for seconds or maybe minutes. It won't last for hours together.
Okay.
But it's the most severe form
Mm-hmm.
of anxiety when your brain suddenly releases large amount of stress hormones. That's when you have panic attack.
Okay.
Panic attack will um, resemble heart attack. most of the
Okay.
conditions, most of the patients with panic attacks, they're rushed into our emergency rooms, thinking it's a heart attack. Then immediately we do an ECG, echo, and whatever the entire cardiology thing we do,
Mm.
and then we see that the waves are normal from the heart. That's when we realize that it was a panic attack. We always rule out. We don't
Okay.
say it's panic attack and not do anything about it. So we always rule out a
Okay.
cardiac condition and then treat for panic attack. So how do you know? Your
Okay.
heart beats very, very fast. You feel like it's going to come out of your mouth.
Oh
You
my God.
feel
Okay.
breathless. You feel your chest is tight. You feel your mouth is dry. You feel your vision is getting blurred. You're not able to see things clearly. You feel like you're going to faint anytime. You feel like you're going to vomit. You feel like you're going to urinate in your pants. That kind of thing,
Okay.
which can resemble heart attack.
So I think anybody who is actually getting into that phase should immediately go and see a doctor, right?
Mu-
Because I think,
mu-
yeah. Okay, so a couple of other things like I think we're getting some questions where how do we deal with failure or insults? Like say for example, a lot of people have are forgetting how to deal with failure right now, right? And as a result of it, there are a lot of insults or embarrassments that are happening. So if somebody is in that phase, is there a way for them to deal? I know it's a psychological question, but just to understand because
Yeah. So, I mean, see, as a doctor, I can't answer this, but I'll answer as somebody who has an opinion. But I think my opinion is pretty decent in this. I think
Hmm.
we all need to change the meaning of failure, firstly, how
Mm-hmm.
we perceive the word failure. When you hear the word failure itself, we immediately equate it to loser, somebody who lost, like
Mm-hmm.
somebody is not worthy of things. So I think we need to
Hmm.
change that. And also we need to change another thing where success is the only normative thing. Success
Hmm.
is the only target. It's not going to happen.
Yeah.
Anything I do, it can be a hit or a miss. I could have become a
Mm-hmm.
good doctor. I could have become a horrible doctor. You never know.
Hmm.
You just never know. Till as a 18-year-old or 17-year-old, when I got into medicine, how do I know that I'm setting up myself for a success? You never know.
Hmm. You
So
never know.
I think as a solution, as a generation, I think we need to teach at least our younger generation that failure is okay. Actually, a lot of parents are doing,
Mm-hmm.
but some families they don't know any better. Failure is a
Mm-hmm.
very normal thing, and that's how you learn things. I'm glad. I always tell people, I'm glad you failed. That's not for me to motivate them, right? I genuinely,
Hmm.
I'm glad they failed. That's when they know that oh, there's something called success as well. How do you ever know otherwise, right? So I think you need to
Okay.
change these definitions and change how you look at them. For example, in MBBS first year, if you fail, you're not allowed to go to the second year. You will stay back
Oh,
there,
okay.
and 6 months later,
Hmm.
you'll go back. So as an 18-year-old, I always wanted to be with I want to move ahead with my friends. I didn't want to be in the
Hmm.
batch, another batch, right? So I put a lot of stress on
Exactly.
myself. That's what a lot of students do. Put this thing on themselves.
Yeah, on themselves actually.
Yeah, I mean, it's not worth it. See, give your best. I'm not saying just be very casual. It's okay if you fail,
Yeah,
but
exactly. Yeah.
give your best. And if your best is not enough, it's okay. You can always try later. What's the worst thing that will happen? How
Exactly.
do you know right now when I'm sitting in front of you if I passed or failed in my exams in the first attempt? You never know.
Hmm.
You only judge me
Exactly.
based on how I am today and how I talk to you today.
Exactly. So coming to the other topics of say suicidal tendencies, right? This is one of the things that we wanted to talk about. Is it like if somebody has a thought of a suicide, right? Like a lot of people, like somebody say things that okay, I should do something like this. Is that the first point that they should come and actually go to a doctor, or is it also like how we were talking about stress, anxiety? Yes, sometimes we get stress, sometimes we get anxiety. So the first trigger point, is it like the first thought itself you get that's actually a very serious symptom? Or is there like no, there is still some more things that have to happen to actually take this up really
I
seriously?
mean, it's better not to take chances when it's about your life because it can be
Mm-hmm.
life or death. It can be a hit or a miss. So I think it's better not to take
Hmm.
a chance. Immediately, you don't have to run and see a doctor, but at least talk to somebody and do not act on those thoughts. When you get a thought, like, sometimes we all get these thoughts, maybe very passive,
Mm-hmm.
not actively, like, array, what is this life? Might as well end it. It's not worth living.
Hmm.
I'm sure I got it. I'm sure you must have got it some point.
Hmm.
But you should know if you're going to act on it ever or not. Like me as a person, I think I'm not going to act on it unless I have clinical depression. That's a different thing. But me generally
Mm-hmm.
sitting here, let's just say I lost my job or I had a breakup or whatever I think is such a
Mm-hmm.
massive thing in my life. Immediately I might get a thought that let me just like end it here. That my life is not worth.
Mm.
But if you think you're going to act on it, that's when reach out for help. Help doesn't have to be immediately seeing a doctor, because usually these thoughts come early hours of the morning or late nights. They don't come in the day
Okay.
when sun is up and everybody's out.
Oh,
You
okay.
feel lack of social support at that particular time. That's when you can't reach out to too many people. So there are
Mm.
suicide helplines. India is not there yet for good suicide helpline network. I
Mm.
hope we get there, just like other countries like America. Um,
Mm-hmm.
I think first thing is put yourself out of any lethality. For example, if I'm standing in the balcony and if I'm getting my suicidal thoughts, come off from the balcony.
Mm-hmm.
There is a logical
Okay.
part of the brain also that has to predominate.
Mm.
If I have knife around, just throw the knife. If I have a rope or anything, just throw it away. Call someone and talk to them. No. Also, again, see, people are scared that they'll get judged, right?
Hmm.
Uh,
Yeah, I think that's one of the biggest problems, right? When you want to talk about something, people always think that somebody is going to think something of me, right? So how
So I,
do
I think
so
we should also educate not the people, not only the person who is feeling suicidal, but also other people
mm-hmm.
who look at suicide. Even when I look at families, right? There is death
Mm-hmm.
in every family. It's normal, right? I mean, you can't have a family
Hmm.
without death. But if you lost somebody because of, let's just say, road accident versus somebody
Mm-hmm.
who had cardiac arrest, a heart attack, or
Mm-hmm.
versus somebody who died of suicide, people
Mm-hmm.
are very hush hush about suicide, you know,
Hmm.
because of the judgment and the stigma
Very
in the society. Uh,
very true actually.
yeah, I'm not saying go just scream out and tell everybody. Sometimes when you lost someone to suicide, I think the first thing you need to do is get help for yourself, because it's very difficult to process.
Hmm.
So speak to somebody that otherwise you'll be always guilty. You feel like you have done something wrong to this with this person. You could have saved. It could be my brother. I can feel like I should have saved. It's my fault. There is a lot of self blame and guilt associated with it. So I think open
Hmm.
conversations are very important. I'm glad people like us are doing these lives, and I'm sure many other doctors are speaking at the same time while I'm talking to you. I think conversations are very important, and do not
Hmm.
act on impulses. Just know that suicide, a lot of people who commit, they don't, it's not a well planned act. Most of the time, it is very impulsive.
Okay.
I'm telling you, as a doctor who deals with, goes to ICU almost every second day for treating somebody who came with suicide, right? They must have drank some
Okay.
pesticide or had taken all the medicines that they have in the house.
Hmm.
Most of it is impulsive, and most of them feel guilty of doing it. They feel like, had I stopped for 5 minutes or a minute, I wouldn't have been in this position.
Would have been that
Most of them
okay.
even say it's a very silly reason. They had an argument with their spouse, and
Exactly.
then they did that. So,
But when you say that the act might be actually immediate, like might be impulsive, right? But is there a process that actually builds to this? And is there like a saying that, is there a something like, okay, you say that, okay, are you, if you're feeling like this for certain duration, it's really dangerous. Is there something, or is it like I can get this impulse in one day and I can actually commit, or is it like this actually builds over a period of time?
no, I mean, if things are okay in your life, I think nobody will think of ending their life. If they have work stress
Hmm.
or family stress, somebody who is in an abusive relationship, then that's very, very important.
Mm-hmm.
People who are, sexually abused or physically abused, any kind of abuse. Again, one more important tip is do not drink or like don't do any drugs when you're feeling suicidal, because your logical part of the
Okay.
brain that I was telling you should predominate will not predominate. You'll be very impulsive.
Okay.
You'll be in the moment. So I tell patients always, do not drink alone or when you are sad. So
Hmm.
you should only have a drink. I'm not saying you should have a drink. You can have a drink if you're saying something, with
Yeah,
group of
exactly.
friends. That's a very different thing. You should never use
Hmm.
alcohol as a drug for sadness or any of that, because most of the people who
Hmm.
attempt suicide are the ones who we always smell alcohol from their breath. So I
Okay.
think that's a risk factor.
So basically, the thinking part of the brain shuts down, and then the impulsive part takes over. I think
So
so.
yes.
Yeah. So one more question I think I'm getting is there a difference between mood disorder and bipolar disorder?
So mood disorder. It's like fever. When I say fever, there are many kinds of fever. There is malaria, there
Mm-hmm.
is dengue, there is typhoid, there's COVID. There are
Mm-hmm.
different things. So
Mm-hmm.
mood disorder is like that. Under that, you have depression, you have bipolar disorder, you have many other disorders. So bipolar
Mm-hmm.
disorder comes under mood disorder.
Okay. But both of them are completely different
No,
aspects
no,
in terms of,
no, no, it's the
okay,
same thing. It's the same thing. Like I said,
it's the
under
same
fever
thing.
you
Okay.
have different types of fever. So under mood disorder, there are different types of mood disorder. One of them is bipolar.
Okay. And the other thing is, a lot of people who are asking, is meditation a way to deal with these things, right? Because I'm getting a lot of questions who are saying that can we meditate and actually get them through? Or can I meditate and actually find a way out of this? So if suppose somebody is in depression, anxiety or something, is meditation like a self healing thing, or what do you have to say about that?
It's like me telling if you have diabetes, let's just say
Mm-hmm.
sugar levels are not controlled at all, right?
Mm-hmm.
I'm not gonna, you don't see doctor, but just stop eating sweets. That's not gonna help,
Mm.
right?
Okay.
You have to see a doctor. Along with that, you'll have to do many other things. Anytime
Mm-hmm.
medication only gives a relief of about 70%, which is a big number. But when you call it
Mm-hmm.
recovery, when it's 100%, otherwise you don't call it recovery. You just call it maintenance. Patient is
Mm-hmm.
maintaining well. I always write in my
Okay.
notes, if any of my patients are seeing, patient is maintaining well. That's for you. You're not doing anything else but taking my medicines, which is the easiest part.
Okay. Okay.
Then comes then comes you meditating, doing yoga. All those are fantastic. But for someone who doesn't have depression or anxiety, if you're daily meditating, doing yoga, or doing kickboxing or workout, dancing, whatever, that will that may prevent you to have an anxiety or depression. So I hope
Mm-hmm.
you got the
Mm-hmm.
difference. So for me, right now,
Mm-hmm.
I'm mentally I'm sound. I don't have any mental health conditions right now. So if I'm working out every day, I'm doing meditation every day. Good chances that I will be able to deal with my stress very effectively. I might not have
Mm-hmm.
a illness, but if I'm having an illness and then I'm sitting and meditating, that may not help.
Mm, got it. So basically, it's more of a prevention thing, but not a cure actually. So
Not
people
true.
should not just think that I'm going to do this and it's going to get better, right? Got it. And one of the other common things I think people are talking about is anger. If suppose there are people who are very good, they are very fine, they don't have any issues, but all of a sudden they get angry. Is that also a sign that there is something wrong, or is it just their nature? Because, again, the differentiation is very, very difficult, right? Most of people do not understand how to differentiate. So if suppose somebody just triggers and he becomes really angry, and, is it like there is some issue and we should be able to, understand that there is an issue going on? Or is
So
it just like that guy's nature itself is instinctive and he's just going to shout?
anger is a very normal thing. I think I'm a very angry person generally. Like I get angry at very little
Mm,
things. So it's a normal thing. But what differentiates is that I don't react that much. When I'm angry, I tend to
mm-hmm,
I have ways to calm myself down. So that makes me normal.
mm-hmm,
That doesn't make me abnormal or
mm,
cranky person. But somebody who is
okay.
reacting, trying to hurt others or responding in a way that will hurt others, I think that
Mm-hmm,
is not normal. So there are anger management, therapies, etc., that you can definitely take. But
mm-hmm,
otherwise, what you could do is, turn your anger into, uh, you know, your aggression into um, a subliminal way in terms of, go for a run when you're feeling angry,
mm-hmm,
or take a rope and start skipping, or go play a basketball or whatever, football or whatever. Or you can listen to loud music. There are different ways for you to channel your aggression rather than you hurting somebody physically or hurting yourself physically or verbally
mm-hmm,
abusing someone. That's not going to do it because that will increase your blood pressure. A lot of even in movies when you see someone has anger and suddenly they collapse and they call it stroke.
mm-hmm,
He's paralyzed. It has a little bit of
mm-hmm.
meaning because if you're already hypertensive, if you're very angry, the blood pressure might increase so much that you might have a clot or a bleed in your brain. So it's good to control
Okay,
anger for your own good. And second part
okay.
is, a lot of people feel very manly about feeling angry. They feel like,
I
I
think
think
that
there
is
is there is
really.
so much toxic masculinity where one has to be angry. That's when you're a man. You have a lot of testosterone. No, that's
Hmm.
not true. The good chances that you
I
will
think
be.
that is a good thing you have brought up because a lot of people have this feeling, and I think that's been stereotyped in a way where if somebody beats somebody, he's so manly, and the movies especially, a lot of movies which are showing these kind of things.
Yeah.
So one more thing is, before we close the session, a couple of other things that we're getting is there a link between any sort of physical things that I do, like maybe play a sport which is an aggressive sport, or something that has an impact on my way of reacting to things in your normal life? Because, like, for example, there are a couple of questions which come, like, some people become more aggressive when they do, say, kickboxing, they start doing the same thing outside. Or some people, like, we're getting questions where they say, I'm meditating, but it's not giving me that calmness. I'm becoming more of a reactive person than actually calming myself. Is there a reason for that?
I think that's when I think therapies definitely work. I think therapies bring out a lot of unresolved conflicts. We all have unresolved conflicts. I mean,
Mm-hmm.
I'm not saying anybody who asked this question went through this, but I'll give you an example where this one patient of mine was sexually abused as a child or as an
Mm-hmm.
adolescent. And she or he didn't know that time that it was an abuse. They didn't know what was going on with
Mm-hmm.
them. Right after that, their
Mm-hmm.
brain start wiring in a way where it started making the person very emotional, extremely angry, extremely happy, extremely emotional. Extremely reactive as a person. So when I
Okay.
took the history, obviously, I didn't know about the sexual abuse, nor did the patient
Mm-hmm.
tell me. When I sent them to a therapist, I think in therapy it came up that they were sexually abused. I think once when you resolve a unresolved conflict, I think that's when these kind
Mm-hmm.
of you know severe impulses will go down. I feel.
Oh,
I'm not saying
okay.
everybody who is angry was sexually abused. That's not what I mean. But there could be some underlying conflict that might be causing
Okay.
it.
So one last question to end the session. So, is it normal for people to feel low? And if they are feeling low, is it fine? And is there something that they should be doing? Is there something that they can do to make them feel better? And is low also a kind of issue in terms of it could be as like how you said, stress is normal, but anxiety is not normal, right? So is being low, how do you define low? That's because this has become a trend, right? A lot of people say, I'm feeling low. And I'm seeing more new generation people, the younger kids also, who are like studying intermediate, or they become a fancy word, I'm feeling low. So how do you basically differentiate this, and how can you come out of this?
The feeling low is very normal. I feel low twice a day at least. It's very very normal. Uh, so that's when I'm telling exercise is very important. I don't know if a lot of people agree with me or they had the same experience. When I'm feeling low, if I immediately go for a run, immediately I feel better. So does
Okay.
me eating my favorite meal. So does
Hmm.
me drinking lots of water and having a conversation with a friend of mine. So does me painting or taking my phone and taking a great photograph.
Hmm.
Whenever I feel low, probably because I saw a patient who went through something very bad, it does affect. Obviously, it doesn't affect as I'm a human after all. Immediately, I go take some pictures, around me.
Oh,
Immediately
yeah.
gives me happiness. So you can do many things to lift your mood up, right?
Hmm.
Exercise, I'm not saying because you come from a exercise background, but
No, no, yeah,
exercise
yeah,
is
no,
one of
understood.
the, I swear by exercise. I tell my patients, workout. Working out is not for looking good. It doesn't matter what good looks mean to you. Work
Hmm.
out for your endorphin rush and work out for that feeling good, and do not work out in the night before you go to bed. You're supposed to work out.
Hmm.
Your day is supposed to start with workout. It could be simple stretches or surya namaskaras or whatever in your balcony. Get some sunlight, soak in it.
Hmm.
Do some little bit of workout. Listen to nice pleasant music or some podcast. And
Hmm.
start your day. It sets a good bright positive note to your day, and mostly it tends
Hmm.
to be on that. But if you don't do like that, and if you, like, say I'm waking up and I'm taking my phone looking at how many people died of pandemic or how many
Hmm.
landslides happened in Himachal,
Uh,
and then I'm getting up, I'm again snoozing my alarm, sleeping, getting up, and then I'm rushing into my work because I have to log in.
hmm.
It's gonna set a very negative tone or undercurrent to your day, and that's gonna stay like that. So
Hmm.
feeling sad is very normal, but if you think you're feeling sad most of the day and nothing is cheering you up, and you're feeling very tired, your sleep is disturbed, you don't have concentration, you feel hopeless, that is clinical depression. Then you see a doctor. Just for feeling good, you don't have.
So one last question, because this is out of my curiosity that I'm asking, because you said morning, evening. Is there something like, are there people who are night people and day people? Because this is something that, you are saying get up in the morning and that's the best time to do your workouts and do, right? But again, there is another the set of people who say, no, no, yeah, I'm more active in the night. This is the way I sleep at 2, 3, but I get up at 11. Is there actually something of that sort from a neuropsychiatrist perspective, or is it like just your way? You will just have to put your mind and get up.
No, no. So I'm not saying wake up at 6 o'clock. I mean, that's the best way.
Mm-hmm.
Definitely, that's the best. That
Mm-hmm.
will change your life. But for example,
Mm-hmm.
me, I'm a night person. I know I'm very active in the nights, and
Mm-hmm.
that's when I post things on my Instagram. Instead of me preaching all these things, I might not be doing all these right. At the end of the day, I'm a human.
Mm-hmm.
I guilty as charged. But just know that there is a clock inside your brain also, just like you have a clock outside on the wall.
Mm-hmm. Okay.
It's there in a gland. It's there in something called a pineal gland. In your brain.
Mm-hmm.
It runs for 25 hours, not 24 hours, 25
Mm-hmm.
hours. If that is not synchronized with your outside clock, good chances
Mm-hmm.
that you'll have a lot of health problems.
Oh,
For
okay.
example, when the sun is down,
Mm-hmm.
something called melatonin gets secreted in by your brain. Melatonin is
Mm-hmm.
something that lets you sleep, gives signals to your brain that sleep, it's time to sleep. When sun is up, melatonin production gets stopped from the brain, so you're supposed to be active. That is when you'll have a
Mm-hmm.
proper sleep. No matter how
Okay.
expensive curtains you have, I have very expensive curtains here, which block out all the light and makes it feel like
Yeah.
a night only in the morning. So those all won't help. So good chances that you'll have a lot of health conditions if you are not having a sleep schedule. You cannot confuse your
Mm-hmm.
brain and expect it to be still be healthy. So most of
Okay.
the people's, even children, health conditions are worsening only because of the sleep habits. I strongly believe in it as
Okay.
a doctor and somebody, who doesn't have a great sleep hygiene. I know the difference. I know the days when I sleep
Mm-hmm.
early and get up early, how I function as a doctor, as a person, versus someone who didn't. So if you
Mm-hmm.
see kids in today's generation, they're sleeping very, very late, isn't it? I know my friends' kids when I'm hanging out with them, they're also up with us till 1 o'clock. Back in the day when I was a
Exactly.
child, I was sleeping by 9 o'clock. I didn't
No,
know what is 2 o'clock.
exactly.
So I think I want to educate this. I want a lot of people to tell others also. Sleeping on time, waking up on time, mostly around your sun and moon, synchronizing with them is going to do a lot of good to your health.
Mm. Got it. So I think I hope I've cleared most of the questions. I've tried my best to actually combine them actually because of a lot of them. But Dr. Charan, thank you so much for joining on our first doctor session actually. So it's really nice having you. And I hope everybody who was there, got a lot of information that they wanted to get. So I hope we'll have you again on our live shows sometime. Thank you so much.
Thank you. Thank you.
Thank you, guys.
Pleasure is
Thank
all
you.
mine. I'm glad you're incorporating doctors because I think fitness and health, like I said, goes hand in hand. Hoping to see many more doctors on your page.
Sure, sure. Thank you so much.
Thank you. Have a
Thank
good
you,
day.
guys. Thank you. Thank you.